Have you been told to use artificial tears and have no idea which one to buy? We've all gone to the store and you see this 50-foot aisle with all these different eye drops. It's overwhelming, and all these little bottles are tiny and there's thousands of them out there. Two ingredients that I would recommend avoiding are a preservative called benzalkonium chloride and another called tetrahydrozoline. And the reason is benzalkonium chloride is a preservative that's fairly toxic to the eye. If you're chronically using the medication, you can develop a preservative reaction, and then your initial instinct is to keep on dosing the eye, and you're adding more fuel to the fire, causing more irritation. Tetrahydrozoline actually shrinks the blood vessels. So when you see on a bottle, it gets the red out. That's typically in that medication. Tetrahydrozoline will shrink the vessel. Your eye will look nice and white, but what happens is the vessel rebounds. And when it rebounds, your eye becomes red again, and you're chronically dosing your eye to get that nice white eye. Some common brands that have both these ingredients in their product are Visine and Clear Eyes. So which products would I recommend? I'm a big advocate for anything preservative-free. So if you're a patient that has a little bit more mild dryness, just need a drop here and there, Refresh Relieva PF, which stands for preservative-free, is a great medication. It's not as viscous, so it doesn't really blur the vision a whole lot, but it does give a good relief to your dry eye symptom for a short term. Being thinner, it actually is also safe to put over the contact lenses. Next up is Sustain Complete PF. This is going to be a little bit more of a viscous medication, which is actually a good thing. You're going to have more contact to the eye. It prevents more evaporation. You're not dosing the eyes frequently. The one thing with this medication, it has a little bit like a creamy consistency to it. So when you put the medication in your eye, being a little bit more viscous, a little bit more creamy, it's going to blur the vision a little bit. Probably not your best option to put over top of a contact lens. Next up is Avizia. It only comes in a preservative-free formulation. It has a unique lubricant called povidone that actually creates like this matrix that kind of goes over the cornea and actually really secures the tear film on the eye, preventing the evaporation. The other thing that's really neat about this medication, it has hyaluronic acid. Depending on the severity of your dry eye, these artificial tears may not do the trick. There's a lot of inflammation involved with dry eye. To help kickstart it, your eye doctor may prescribe you an anti-inflammatory medication. This is Isuvis. It is actually a steroid medication, and some patients get nervous about steroids. Steroids work like magic in the right setting. It really calms the eye down. Patients feel better. They do have side effects, but as long as they're being monitored, it's a great medication to start it off. Then we use that in combination with a lubricating drop. If you look at this medication, this is actually a preserved medication though. This actually is preserved with benzalkonium chloride. And I know I just told you that's a bad thing. However, you're going to be on this for a very short while, maybe only using it 2 to 3 times a day for a few weeks just to calm your symptoms. And then we drop this medication off and then continue with the lubricating drop. The other thing about Isuvis, this is the first FDA steroid approved for dry eye treatment.